We are outside the Council's Markievicz Primary Healthcare Centre, where we are marking the day when Ireland has come top of the European Health and Wellbeing lists for the third year running. Ireland has transformed its healthcare with a combination of primary healthcare centres and a great improvement in lifestyles. We're going to look at one of these one-stop shops for all the medical needs in the community. The improvements in healthcare have been complemented by a big improvement in lifestyle. Hospitalisation has been reduced by 75%, life expectancy has increased for everyone, the lowest incidence of obesity and type 2 diabetes in Europe. Hospital waiting lists are a thing of the past, the MRSA bug has been eradicated, and the use of pharmaceuticals has dramatically reduced. These improvements apply to all citizens. And now we're inside the Primary Healthcare Centre, where I'm speaking to two of the patients who are awaiting their annual checkup.
Today's actually the longest I've ever had to wait. I've been here nearly 3 minutes now. We're just not used to that these days. But I was playing tennis with my great granny yesterday, and she was telling me about how the way things used to be. So I am really grateful. I think that we're not kind of stuck for hours queuing. I can't even imagine that. Everyone I know is very health conscious now, and we really do take advantage of the free yearly checkups.
The system's worlds away from what it used to be when I was younger. I remember waiting over a year to get an operation done on my stomach when people with private health insurance were getting treated for less serious conditions much faster. It's a much fairer system now than what it was. Everybody's treated on the basis of need, and so I'm much happier with it. And also it's a much better use of our taxes.
I'm the Chief Medical Officer of this public primary healthcare centre, and my role is to ensure the health of citizens within this community. When I trained 30 years ago, I worked in a public system that was starved of funds, and patients didn't have access to the care they needed. Access was dependent on people's ability to pay. Today, citizens have a right to come in and get an annual health check at least. They have access to services from medical health, physio, cardio, alternative. When they need consultants, the consultants come here. And the plan of the centre is to meet the healthcare needs of the population. Years ago, doctors had to watch as patients grew progressively worse. Now we can manage people's health, educate them to healthy lifestyles, and see better outcomes for all the community.
So there we are, that's the Primary Healthcare Centre. So going back to studio.